Hi everyone and welcome to the BPSA's podcast on the RPSGB Student Code of Conduct. The BPSA has decided to endorse both the Code of Conduct and also the Fitness to Practice Guidance documents. We would like to tell you why we've decided to do this and also to explain how these documents are actually a very positive thing for pharmacy students all over the country. The BPSA would also like to take the opportunity to offer you guidance and support in interpreting these documents. If you would like more information on this, then feel free to email us on conduct@bpsa.co.uk or go to the BPSA website on www.bpsa.co.uk.
Introduction to the Code. The Code of Conduct aims to set out the standards for the behaviour of students whilst undertaking their undergraduate studies. Currently, most students will be told when embarking on the MPharm that they should be aware of their actions both in and outside of their education, as unprofessional behaviour can be reported to the society and may affect an individual's ability to register as a pharmacist. The Code makes this message clearer by applying professional principles to your practice as a pharmacy student. The Code is based on the 7 principles of the Pharmacist Code of Ethics found in Medicines, Ethics and Practice, a guide for pharmacists and pharmacy technicians. These include: make the care of your patients your first concern, exercise your professional judgment in the interests of patients and the public, show respect for others, encourage patients to participate in decisions about their care, develop your professional knowledge and competence, be honest and trustworthy, and take responsibility for your working practices. The aim is to start letting you think like a professional whilst you are still a student, so that you are comfortable with these principles once you are a registered pharmacist.
So why has the BPSA endorsed the Code of Conduct? As future healthcare professionals, the BPSA recognises that as students we still have some degree of professional responsibility. Therefore, we should start thinking about our behaviour as undergraduates. There are also a number of positive aspects in implementing a code for pharmacy students.
Prior to the development of the Code of Conduct and Fitness to Practice guidance by the RPSGB, it has been very much at the discretion of individual universities as to when and how they have provided information about a student to the society. By setting out clear guidance, this will address any inconsistencies there may have been, which means that whatever school of pharmacy you are studying at, you will be treated the same as everyone else. It also means that you as a student have clear guidance about what is expected of you during your time as a pharmacy undergraduate.
Before the implementation of these documents, Fitness to Practice had not been assessed until the very end of your path to becoming a pharmacist, when you applied to join the Register of Pharmacists. It was not until this point that you were signed off to become a person fit to join the register, or were required to declare any prior criminal record. Therefore, any problems at this late stage were very difficult to rectify, and the Pharmacists Defence Association stated that they have only won 2 out of 4 cases where fitness to practice has been judged as impaired at this late stage in a person's pharmacy career. This means that under the current system, an individual could spend 4 years doing the MPharm degree and complete the pre-registration training, only to be told at the last minute that they cannot join the profession they've just spent 5 years training to join. By implementing these documents, any potential problems can be addressed early in your pharmacy career, and you have the opportunity to demonstrate your fitness to practice and learn from an incident which occurs whilst or even before you are a student. This makes it much less likely that when you apply to join the register, you'll be denied entry based on your fitness to practice, and that one-off incidents in your past will affect your ability to become a pharmacist.
One of the driving forces behind these documents has been that pharmacy is becoming a much more clinically focused profession, which means that as students we are spending more time in environments which involve patient interaction. This is a really great thing for us as pharmacy students to experience, but this needs to come with a recognition of the responsibility that this carries. To make the Code of Conduct a patient-focused document says 2 things. A pharmacist's place is interacting with patients, and that experiencing this as a student is something that all universities should be striving for, both of which are great.
One of the reasons which the BPSA has endorsed these documents is in recognition of consultation work that was done with students in the production of these documents to make sure that they have the best interests of patients and the public at heart without being too restricting to the student experience, which is a big part of your growth as an individual whilst you are at university. Whilst the introduction lets you know that wherever you are representing your university and the profession, the specific principles in the code mainly address your behaviour as a student, whilst you are carrying out your course and your actions whilst on placement, either as part of your degree or during summer and holidays. This means that it's mainly in these environments which you could come under scrutiny that you should be obeying the law at all times. Student input has ensured that fitness to practice outcomes are proportional to your year of study, and that investigations will only take place where incidents are serious or where recurrent offences take place. Therefore, one-off minor misdemeanours shouldn't cause students to wind up at a fitness to practice hearing. Schools have been given until the academic year of 2010 or 2011 to get fitness to practice procedures in place. But where the schools have already got these procedures, they will continue. The RPSGB will be giving support to schools to help them interpret the code and also how to set up fitness to practice procedures. A good part of these is the recommendation that a student should also sit on the fitness to practice committee within a school. Investigations of students breaking the code are only recommended where there are recurrent patterns of poor behaviour or serious breaches of the code. There will also be appeals at a local level for any student being investigated. The BPSA can also be a point of contact for anyone wishing to interpret the code and what it means for you as a student. Questions will be answered by one of the BPSA executive. The email address conduct@bpsa.co.uk for the healthcare professionals. Currently, medics, nurses, midwives and dentists are all required to sign an agreement relating to their behaviour whilst undertaking their undergraduate studies. So if we, as pharmacy students, want to be amongst their ranks with the same level of responsibility and opportunity, then we must be prepared to do the same.
Continuing professional development, CPD, is soon to be a mandatory requirement for all pharmacists, with revalidation also on the horizon. Reflective practice and education appear in the code in preparation for you doing this as a registered pharmacist. The BPSA Professional Development Certificate is our undergraduate version of CPD. By taking part, not only will you be fulfilling this section of the code, but you will also get the opportunity to take part in some great events and competitions, as well as meeting other pharmacy students from all over the country and have a bit of fun along the way.
Thank you for listening to the BPSA's podcast on the Student Code of Conduct. We hope that you've enjoyed it and now feel a lot more comfortable in signing up to its principles. We hope that you also agree with the BPSA that this is in fact a positive document for pharmacy students. Good luck with the rest of your studies, and we hope to see you at a BPSA event soon. Remember that you can also find more information at www.bpsa.co.uk/conduct.